Hey everyone, today we're breaking down myocardial infarction, the signs and symptoms, the treatments, and the nursing care you need to know for every exam. We'll cover everything you need to know for when every second counts. Now, let's dive in. What causes me? The heart muscle dies. Just like all muscles, the heart needs oxygen to pump. During a heart attack, there's a blockage in one or more of these oxygen tubes, called the coronary arteries. The heart muscle suffocates to death. Over 500 cells die per minute. If blocked over 45 minutes, these cells can die forever, which we call necrosis. So remember, minutes equals muscle. What causes this narrowing? Fatty deposits called plaque develop on the walls of the coronary arteries, narrowing the vessels and making it harder for oxygen to get to the heart. So what causes this? Just like with hypertension, we use the acronym SODA. S is for stress. This can cause momentary narrowing from anxiety, cold temperatures, or even physical exercise. Stimulants like caffeine and amphetamines also narrow the arteries. What really causes the most damage are the irritants found in smoking, which scars the arteries, and long-term obesity, BMI over 25. Diabetes and hypertension can cause stretching and tearing to the coronary arteries, and atherosclerosis from a bad diet high in cholesterol causes plaque to build up. This plaque causes the hardening and narrowing of arteries. Signs and symptoms. As for signs and symptoms, any complaint of chest pain is super serious. The exams use keywords like sudden, crushing, radiating, or heavy pressure. A big tip: pain can be in the jaw, left arm, mid-back, or shoulder. Another big one is heartburn or epigastric pain coupled with shortness of breath. Also, look out for nausea, vomiting, sweating, diaphoresis, pale, cold skin, dusky, and anxiety. Here's a tricky thing: diabetic patients can have a silent me because their dead nerves can't feel the pain. And women often tough it out, thinking they're just tired. So me's in diabetics and women often go unnoticed. Diagnostics. For diagnostics, any new chest pain always requires an EKG first. You need to know ST elevation and ST depression. If ST is high, then the heart muscles have died. If ST is low, we think low O2. We always confirm with blood labs. Troponin is our #1 indicator for NME. It's our gold standard. A troponin level over 0.5 indicates trauma to the heart. This always indicates NME. So we treat with drugs like Mona, but we'll cover that in a moment. Treatments and Mona mnemonic: the goal is to unclog the oxygen tube within 45 minutes. The classic treatment is MONA, but for the NCLEX, the correct sequence is OANM. O is for oxygen. A is for aspirin to prevent a bigger clot. N is for nitro, which opens up the coronary oxygen tubes. And M is for morphine to help the heart relax. All of these drugs help get and conserve oxygen immediately. Post-ME complications and prevention. After NME, the heart has some pretty serious damage. Our three most deadly complications are cardiogenic shock, arrhythmias, and heart failure. When we fix the clot, our goal is to prevent future clots and give the heart some rest. We teach the 2 Ds, diet and lifestyle change, and drugs. A huge NCLEX tip: we teach patients to avoid NSAIDs like ibuprofen and naproxen, which can cause an increased risk for clots and future MEs. We can also give antiplatelets like aspirin, and cholesterol-lowering drugs like statins to prevent future MEs. These drugs end in statin and are very liver toxic, so we avoid them in patients with liver problems and avoid grapefruit juice, which can block the drug. Conclusion: that's our breakdown of myocardial infarction. If you found this helpful, be sure to hit that subscribe button and the bell icon for more NCLEX tips. Happy studying, and we'll see you in the next video.